Breastfeeding also reduces inflammation in the body. Inflammation is one of the key contributors to chronic illnesses such as heart disease,
Sometimes I'm
diabetes,
selfish,
arthritis,
get
and even
jealous.
cancer.
I feel a little helpless. My whole world has shifted
while
again.
increasing hormones such as
You made a
oxytocin,
promise,
which reduce
I
inflammation
kept it.
and promote
Now I'm
healing.
second
This natural
guessing.
balance
My
keeps
whole
mothers
world
healthy,
has
both physically
shifted
and emotionally.
again.
Another powerful
Now I
benefit is
drive
that
back
breastfeeding strengthens
to
the
an
heart
empty
and circulatory
room,
system.
and it's
Women who breastfeed have a
said,
significantly
now
lower
that
risk of
your
hypertension,
things are
heart
gone,
attack, and stroke later in life.
what have I
This is because
done?
breastfeeding
Was
improves blood
everything
circulation,
worth this? I
promotes better
guess I
circulation,
deserve
and helps
this.
maintain healthy hormones.
Oh,
These factors
do I
combined can
run
increase the risk of
whenever
infection,
I'm
and
hurting?
breastfeeding also
I guess
promotes
I'm
physical
still
activity and
learning
mental
how
health.
to.
Studies have shown that women who breastfeed are less likely to develop gallstones, fatty liver disease, and other digestive problems. By encouraging better metabolism and organization, it also has long-term effects on a child's emotional and psychological development. Breastfeeding is also beneficial for metabolism. By helping regulate blood sugar levels and improving insulin sensitivity, it lowers the risk of type 2 diabetes. This is especially important for women who experienced gestational diabetes during pregnancy, as breastfeeding helps reduce their chances of developing permanent diabetes. For women recovering from childbirth, breastfeeding plays a role in faster healing. It encourages the uterus to contract, reducing postpartum bleeding and helping the body return to its pre-pregnancy state more quickly. This not only supports physical recovery, but also lowers the risk of certain complications after birth. However, it's not clear how far physical recovery is equivalent to mental recovery, since some colonists are more likely to report seeing loss of birth weight. But this is not only supports physical recovery, but also lowers the risk of certain complications after birth.
Looks like a blink of an eye's not enough. She'd rather be staying for days now. I'd rather fix it than mess up again.
Breastfeeding continues to be one of the most profound ways a mother can invest in her own health, while giving her baby the best possible start in life. Each time a mother breastfeeds, she is not only passing vital nutrients and antibodies to her baby, but also triggering processes in her own body that protect her from serious illnesses. These benefits are often overlooked, yet they remain essential for both short-term recovery and lifelong health. One major way breastfeeding benefits mothers is by stabilizing hormones after childbirth. During pregnancy, hormone levels fluctuate dramatically, and this can sometimes lead to imbalances that increase the risk of certain diseases. Breastfeeding naturally regulates these hormones, lowering the chances of developing reproductive cancers such as breast, ovarian, and uterine cancer. By balancing estrogen and progesterone, it also prevents hormonal swings that might otherwise cause long-term health problems. Breastfeeding also reduces inflammation in the body. Breastfeeding helps mothers stay healthier and stronger. Another advantage is that breastfeeding helps regulate the menstrual cycle and delays the return of periods after childbirth. This natural spacing between pregnancies not only helps mothers recover, but also reduces exposure to hormones linked to reproductive cancers. It is a natural and healthy benefit that supports overall reproductive health. For women with a family history of chronic illnesses, breastfeeding provides additional protection. If a mother has a genetic predisposition to diabetes, heart disease, or cancer, breastfeeding can significantly lower her risk. It acts as a natural defense mechanism, giving women more control over their long-term health. The emotional connection between mother and child is also a health benefit in itself. Breastfeeding creates a deep bond that improves emotional well-being for both. It provides protection against infections and prepares the baby's digestive system to handle life outside the womb. Colostrum contains high concentrations of immunoglobulin A, IgA, white blood cells, and growth factors, giving the baby a strong immune foundation during the most vulnerable days of life. Breast milk is a dynamic, living substance that changes in composition over time to meet the baby's unique and changing needs. It provides the exact amount of proteins, fats, carbohydrates, vitamins, and minerals required at every stage of infancy. Unlike formula, which is static and manufactured, breast milk is tailored to support a child's development and even adapts during illness by increasing antibodies when the baby is sick. Another incredible aspect of breastfeeding is the protection it provides against common childhood illnesses. Studies have shown that breastfed babies have lower rates of ear infections, respiratory illnesses, gastrointestinal infections, and sudden infant death syndrome, SIDS.
Maybe I'm an alien. Must be something heaven said. Payback for the love I spent.
Packaging, plastic waste, and transportation. Breastfeeding is a zero-waste,
This time I'ma keep it gon' stay fucked up, feel so good. High on my the sky underneath my feet. It never looked so good. Oh my, that's right. I'ma keep it up, stay fucked up, that's my mood.
It offers safe and uncontaminated nourishment in conditions where formula risky. Organizations around the world encourage breastfeeding as a during These benefits make breastfeeding a natural shield against some of the world's most common and dangerous diseases. Weight management is another area where breastfeeding helps mothers significantly. Many women find it difficult to lose pregnancy weight, but breastfeeding naturally burns extra calories, helping mothers return to their pre-pregnancy weight more easily. This also lowers the risk of obesity, which is a major contributing factor to heart disease, diabetes, and other chronic health conditions. Breastfeeding also supports bone health. Mothers who breastfeed have a lower chance of developing osteoporosis and arthritis later in life. This is because breastfeeding improves calcium absorption and helps keep bones strong, even as women age. The protective effect continues for years, making it one of the long-term benefits of this natural process. Mental health is another area where breastfeeding provides crucial support. New mothers often struggle with postpartum depression, anxiety, stress, and emotional exhaustion. Breastfeeding helps reduce these risks by stimulating hormones like oxytocin, which promote relaxation and emotional bonding between mother and baby. Mental health is another area where breastfeeding provides crucial support. New mothers often struggle with postpartum depression, anxiety, stress, and emotional exhaustion. Breastfeeding helps reduce these risks by stimulating hormones like oxytocin, which promote relaxation and emotional bonding between mother and baby. This creates a positive cycle that benefits both mental and physical health. In addition to reducing stress and depression, breastfeeding can improve sleep quality for mothers. Even though babies wake often, breastfeeding hormones help mothers relax more quickly and return to sleep faster. This improves overall rest, which is essential for recovery after childbirth and for maintaining long-term mental health. Breastfeeding also strengthens the immune system of mothers. While it is widely known that breast milk protects babies from infections, mothers benefit as well. Women who breastfeed have a lower risk of infections such as urinary tract infections, mastitis, and other inflammatory conditions. By supporting the immune system, breastfeeding helps mothers stay healthier and stronger. Since some colonists are more likely to report seeing loss of birth weight, but this is not only supports physical recovery, but also lowers the risk of certain complications after birth. Breastfeeding is also cost-productive and convenient, which indirectly supports maternal health. Since it is always available, sterile, and nutritionally complete, mothers avoid the stress and financial burden of formula feeding. This ease reduces anxiety, helps mothers focus on recovery, and creates a healthier environment for both mom and baby. Altogether, breastfeeding is not just a gift for the baby, but also a natural medicine for mothers. From lowering cancer risks to protecting against heart disease, supporting bone health, improving mental well-being, and helping with recovery, its benefits are far-reaching. Choosing to breastfeed gives mothers a lifetime of health advantages, making it one of the most important decisions for both their own future and their child.